Can you see? Pharmacy. Okay. How's your project going? Good. Okay. You ready to present on Friday? So make sure you have teamwork because this is a partner or team project. Okay. One of the biggest legislations that was in effect that affected the pharmacy practice is that what we call the OBRA 1990. The OBRA 1990. OBRA, hint, hint, wink, wink, this always comes up on the PTCE. OBRA stands for Omnibus Budget Reconciliation Act. Omnibus Budget Reconciliation Act. Okay. This PowerPoint was made by one of my students during pandemic, and it's cute. That's why I like to use it. Right? The what now? He said. Okay. So, the Omnibus Budget Reconciliation Act. That's why OBRA was signed into law by President W. Bush to counter the national budget deficit against his campaign promises to lower taxes. Does it have something to do with pharmacy, right? But it does. Okay, why? What actually affected pharmacies didn't go into effect until 1993. Remember, this act was enacted in 1990. But it only covered or affected the pharmacy practice not until 1993. Okay? But you have to remember when you hear OBRA, it's still 1990. Okay? Well, it's kind of confusing, right? How is this related to pharmacy? Because it has something to do with budget, lowering. What was that? What was said a while ago? Lowering taxes. Okay? Well, the law sees the value that a pharmacist's knowledge of drugs added to patient care is very important. Right? It's about Medicare and insurance. A major part is that pharmacists must counsel Those are the words. What's important, OBRA 9090, again, took effect in 1990, but did affect pharmacy practice until 1993. What's important here is pharmacists are required to counsel. Here's how it started. During this time, pharmacists are only required to counsel Medicaid patients. Why? They need the most counseling, they said, okay, during this time. But that changed. Why? Why did it change? Because it's not only a specific group of people or insured that needs counseling, that needs to know about their meds, right? About their prescription. So they extended this to everybody has to be counseled. Every single patient has to be counseled. This is what I always tell you. New prescription is to pharmacist. Refill is to technician. So when you see a new prescription, because of this law, what do you need to do as techs? Tell the pharmacist that it's a new prescription. You can actually prep it, hold it, but since it's new, an automatic thing that should come to you is to call your pharmacist for counseling. I don't even want you asking, do you want to be counseled if it's a new prescription? No, don't ask that. By law, pharmacists should offer to counsel, should counsel with every new prescription. You following? Before it's only specific. Okay. Now let's define what's the difference between Medicare and Medicaid. How do you remember? Medicare, since it was mentioned, versus Medicaid. Medicare. Very good, Ashley. Okay. This is how I remember this. Medicare, we give care to the elderly. That's my magic word, the care, okay? But it's not only for the elderly. There are specific groups of people or patients that fall under Medicare. Homework. What are the other groups of people or patients that may fall or that may have Medicare insurance? This is good though. But Ashley mentioned Medicare, care for the elderly, right? Okay. But what about Medicaid? How do you remember that?
Aid for low
Aid. Very good. Aid for what?
low income.
Low income. Okay, for the low income group. Okay. These are just good markers or words to help you remember differentiate Medicare from Medicaid, so you don't flip-flop them. However, again, homework, that's where I'll start off tomorrow. Medicare doesn't only cover the elderly, primarily the elderly. There are groups of women or children, okay, or people or patients that fall under Medicare. And who are they? So you know. Okay. Another thing that you want to remember. Medicare is federal. Medicaid is state. Right? Hint, hint, wink, wink. Another PTCE common question. Medicare is federal. Medicaid is state. State run. So when you get an insurance, what do you charge first? You get an insurance for both. So for example, charge the state one first. The budget of this is how I remember. The budget of the state has to be used up first before the budget of the federal government. Okay. You also have, which isn't part here, but since we're talking about insurance, what's TRICARE? Why what's TRICARE? Very good, military families. Okay. So TRICARE, if you encounter that, that's for military and military families. Is OBRA clear? Okay. What does OBRA cover? Tiny, let me read it for you. But you have it in your packet right here. Okay. So it says here, OBRA 9090 covers, it's also blurry right there. The primary focus of pharmacy activities required under OBRA 9090 include, but not limited to, just so you know, prospective DUR. What's DUR?
Drug utilization review.
Drug utilization review. Hint, hint, wink, wink. DUR always comes up on the PTCE and ExCPT as well as a question. Okay. Drug utilization review. Okay. What are possible DURs? Is the prescription necessary? Question on under that is the prescription necessary and appropriate? Factors to consider. First bullet. Over or under utilization. Next bullet, therapeutic duplications, which is a big problem, especially if a patient is taking a prescription drug and then takes an over-the-counter drug and sometimes herbal medication, okay, or even supplements or complementary and alternative medicine, and the patient is not aware that there's therapeutic duplication. Okay, this is very, very important. Or the patient went to one doctor and went to another doctor, right? Two drugs with the same exact function. Okay, cannot expect our patients to know what you know about drugs. Okay. Drug to disease interaction is an example of a DUR. What's drug to disease? You take a certain drug that's contraindicated for the disease that the patient or you have. Aspirin and chicken pox, she said. Okay. Say, for example, the drug has contraindication for patients with liver problems because it's metabolized by the liver. These are things that pharmacists should be looking out for. Okay. Another DUR that pertains to drug to disease, patient has kidney problems or had kidney surgery, whatever it is that pertains to the kidneys. And then drug has contraindication saying contraindicated to patients with kidney problems. Right? Okay. So that's drug to disease. That calls for a DUR. But here's the kicker. You cannot catch this mistake or possible problems if you don't have enough information in your database or in your patient information or profile. Your computer and your software is only as good as the user and the information that's in it. You follow? So if you don't interview your patients, no matter how good the software is or your system is, it's not going to catch it. That's why I always ask technicians, interview. That's not counseling. That's not illegal. Not only the name, the address, the prescription, the date of birth. Ask them if they have allergies. Put that in the system. Because your system will catch a possible, which is next for me, drug to allergy interaction. Okay. Ask them about diseases. Okay. If you know that the drug prescribed has interaction with food, ask them if they take that food. What's an example of that? What am I talking about? Warfarin interaction with what food?
Broccoli.
Broccoli. What else? Give me another drug interaction with food. What was that? Abuse. And to abuse what food? Drug to food. Drug to food. What about grapefruit? Grapefruit juice. Very popular question on the PTCE. So I said, right. I'm telling you a lot of tips for the PTCE and the ExCPT right now. Grapefruit and grapefruit juice. Contraindicated to what? What drug or what group of drugs? Yeah, those are things that you want to tell the patient. Common. What's grapefruit juice? Contraindicated over, add that to your hand. I want to know, because this always comes up on the PTCE. Okay. You should not give, or you should say, you should warn the patient if you're taking grapefruit or grapefruit juice, okay, that this has an interaction with this drug. Okay. What is that? Maybe when we come back from break, you can give me the answer to that, right? Okay, we're done with drug to disease as part of the DUR. Drug to drug interaction. Okay, here we go. You've been, some of you, 1, 2, 3, 4. She's not here. Vanessa's not here. 5 of you have gone through more than one pharmacology. Okay, so I expect you to respond and answer. Give me some answers. You just finished pharmacology, right? First three weeks. Kaden and Clyde. So can you give me example of a drug-to-drug interaction, meaning two drugs that interact with each other? So they should not be taken together. Drug-to-drug interaction. Now you understand why I picked to choose law? There's so many tips I can give you for the PTCE by teaching law. Because I go back to your pharmacology, I go back to your inventory, I go back to, not math, I'll teach math. Drug-to-drug interaction. Give me an example. Let's start over the seniors. Edwin. You've had 4 pharmacologies by this point. Remember how I told you pharmacology on the PTCE is about 60%. 62. Safety involves pharmacology. A lot of questions on drug-to-drug interaction. With a new blueprint with the 2020, current 2020, 2022. We changed it in 2020. What is it? Drug-to-drug. Geneva.
Trying to remember. I know something about MAOI and
Mouse.
yes.
Inhibitors.
There's 3 groups of that they can't go
Okay,
together.
find it. So tell me. Can you imagine? Usually OBRA, I just go over this for a few minutes and then move on. But these are important because I know they come up on the PTCE. Okay. What are drug-to-drug interactions? Okay. Ashley, you want to give some?
I got an NSAID and a beta blocker.
An NSAID and a beta blocker. Ashley said NSAID and beta blocker. What are NSAIDs?
Steroidal, anti-inflammatory drug.
Correct. Good. Non-steroidal anti-inflammatory drugs, NSAIDs. Okay. What does it do?
Inflammation and pain.
Okay. As the term implies, primary function is anti-inflammatory. You follow? Anti-inflammatory, but it's not steroids based. That's a non-steroidal anti-inflammatory drug. So the primary feature or function of NSAID is anti-inflammatory. But actually mentioned pain and swelling. So inflammation and swelling primarily, it only has a secondary function on pain and fever. Can you follow? Very, very little in lowering fever. Give me examples of NSAIDs. Ibuprofen, very good. Ibuprofen is a popular NSAID. Right? Question, is Tylenol, acetaminophen, an NSAID? Is Tylenol, acetaminophen, an NSAID? No, it's not. Okay? People mistake this very, very, very often. The brand Tylenol, generic acetaminophen, or paracetamol in other countries is not an NSAID. It doesn't fall under the NSAID category. Right? It is more an antipyretic, which means, what does it do? Tylenol, acetaminophen, what does it do?
Reduce fever.
If it's an antipyretic, it reduces fever. So the primary function of Tylenol is to lower elevated body temperature with a secondary function of pain. Because when you mix acetaminophen with your oxycodones, hydrocodones, what happens? It increases the pain factor or the feature that lowers pain. The feeling of pain or sensation of pain. Can you follow? Okay. So the difference between ibuprofen, which is very important, that's why I'm highlighting it right now. Ibuprofen versus acetaminophen. Ibuprofen is an NSAID. Okay. So the primary feature of ibuprofen is an anti-inflammatory. So it's for swelling and inflammation with a secondary feature of pain. And when it comes to lowering fever, it's very, very little. Can you follow? So now my question, if you have fever, do you take ibuprofen or do you take acetaminophen? Acetaminophen. Ibuprofen. Under NSAID is also aspirin, abbreviated as capital A, capital S, capital A. It's the #1 NSAID. Okay. What do people do when they have fever? What do they take? Aspirin. Supposedly not, right? What should they take?
Acetaminophen.
It should be acetaminophen because acetaminophen primary feature is an antipyretic. You follow? Ibuprofen and aspirin, two major anti-inflammatories. The primary, again, feature is anti-inflammatory. That means it's for swelling and inflammation. The secondary function of pain. Very, very little on the fever. You follow? So if you're asked which amongst this is an NSAID, Tylenol is not an NSAID. Okay? Yes? A lot of people have been doing it wrong, right? They have fever, they go straight to their medicine cabinets and they grab aspirin. But say, for example, you did some garden work, some yard work, you did some strenuous activities, and you feel like your muscle is sore. What do you take?
I do.
Then you can take an NSAID. Here's the thing. I want you to remember this. And a lot of students remember this. I am allergic to NSAIDs. Okay. So I got no choice, though I don't like drugging myself. I got no choice when I have pain, but to take acetaminophen. Luckily, acetaminophen has a secondary function of pain, especially when combined with other drugs such as your oxycodone, hydrocodone. That's why it's a strong pain meds. 1 + 1 is greater than 2 combination. Following? Okay, let's go back to the drug-to-drug interaction. I'm not skipping. I haven't forgotten, but I need to highlight this, okay? Because it's always a wrong notion, and I always talk about this. Oh, this out. Why do like moms like me, okay? When my son has fever or high fever, I manage it with both. My son is not allergic to infants. Why? Because in combination, Tylenol and acetaminophen alternating is fast at lowering fever. So what do? Let me tell you what I do. I give him acetaminophen. Acetaminophen lasts how long?
4 hours.
4 to 6 hours, right? Ibuprofen lasts how long?
6.
6 to 8. Okay. I give him acetaminophen. I give the next dose with ibuprofen. Okay. Halfway the duration of the acetaminophen, so it overlaps. Okay. Which means either on the 3rd hour, closing on to the 4th hour, I give the ibuprofen. You follow? Then ibuprofen is 6 to 8 hours. Okay. So what's my next dose? And what will it be? Acetaminophen next dose come either the 4th hour, the 5th hour, or the 6th hour. Okay. Then around the clock. You follow? You will notice that the fever goes down real fast with alternating acetaminophen and ibuprofen. But you should not take ibuprofen and Tylenol within an hour apart. You know this? Yeah, that's important information. Why is it an important information? It's over the counter. You can tell your loved ones you can take care of your families better by knowing this simple information. These are 2 or 3 of the most consumed over-the-counter drugs. Fun fact, speaking of over-the-counter drugs. What's the number 1 most abused over-the-counter drug? Yes.
Ibuprofen.
Cold medicine? No.
Ibuprofen.
No. What's the number 1 most abused over-the-counter drug? You will be surprised.
Benadryl.
No.
Laxative.
No.
What else? What else? Aspirin.
No.
What else over the counter? Benadryl, aspirin.
Overused and abused.
Antibiotics.
No, that's not
You
over the
cannot
counter.
get antibiotics
Well,
here in the
but,
United States without a prescription, maybe in other countries, but not in the US. Want to know what? Katie's favorite brand of drug now is Robitussin. What is it?
Is it for pain?
You'd be surprised.
Is it an earring or kind?
It's actually pumps.
Pumps? Oh, that makes sense. That makes a lot of sense.
Right? When I read that, that makes a lot of sense. Because when you have GERD or hyperacidity, it's so
Tums.
easy to pop and chew Tums. And you're not supposed to have more than how many?
I guess 4.
5. And you know what Tums is?
Like a heartburn medication.
Yeah, but you know what it is?
Yeah.
It's flavored chalk. You know, in the old days, you write with chalk. That's flavored chalk. Makes sense, right? When you think about it, oh yeah, Tums. Because you just pop it. How many people do you think overuse Tums? A lot. Okay. What about Tylenol? I want you to remember this. It always comes up on the PTCE and the ExCPT. Tylenol side effect. All the time. Real fast. You should think of that fast. Liver problems, liver damage, liver diseases. Okay, that's why you should not take this if you have liver problems. Okay, side effect. Okay, And then NSAIDs. When it comes to ibuprofen, what's the number 1? Ibuprofen, aspirin, or NSAIDs in general. Number 1 side effect. known side effect. If this is liver problems, liver damage, if acetaminophen is liver problems, liver damage, NSAIDs, bleeding, okay? Take note of these two, okay? Gastric bleeding usually. That's why I'm telling you this, because the PTCE comes in a case or a scenario type question. Patient comes in, complains of. What do you think the patient took? But the patient had bleeding problems already, right? Aspirin, warfarin, or ibuprofen, okay? Which amongst this drug? That's how it's going to be on your PTCE. That's why I don't want you memorizing drugs. Now you understand why I keep saying that? Because I don't. I don't want you memorizing drugs. I want drugs. I want you to understand. Because it's case. It's going to be presented to you. The questions are going to be presented to you in case format. Patient walks in, complains of this. Which amongst these drugs may have caused this side effect? I was in a forum last night. I answered one of the questions in a forum, tech forum. Okay. Of course, they didn't know that I teach. But I saw that there were very, very long answers. In this time and age, the key is fast and simple. Simplify things. The question was, can somebody tell me, please, the difference between side effects, because I talked about side effects, and adverse reaction? There's one who answered like 10 paragraphs explaining adverse reaction and side effects. And I was thinking, oh my God, you lost me. Right? That's why I asked for your feedback. I learned from students and your ways so that I can help you better. Okay? Can somebody tell me the difference between side effects and adverse reaction?
Side effects are the most common and known effects.
Okay.
Adverse are pretty much the rare effects that is like case to case. Like it's like 1 out of 10 people would have it.
Very good. But here's how I answered it. Okay. But you got it right. I said, side effects, the magic word is known. Adverse reaction, usually called ADR, adverse drug reaction, is unknown. And then I elaborated. Known, this is observed during clinical trials. Unknown, which means this is not observed during clinical trials. So side effects have been shown by patients, okay, who underwent the clinical trials. Hint, hint, wink, wink, PTCE as well, and ExCPT, okay? This group where I'm in the form or prepared for the PTCE. That's why I answered, okay? And side effects known, observed during clinical trials. When you say adverse reaction, it wasn't observed during a clinical trial. That's why Geneva said it came out after it's out in the market. And we have to gather this information, this adverse drug reactions, and report it to what?
Midwatch.
Yeah, good job. Hint, hint, wink, wink. PTCE as well. MedWatch. Okay, it's a reporting system for adverse drug reactions. And what happens is, once we gather or once they gather enough, like complaints about this, they will make a decision whether they're going to recall or they're going to add it as a side effect. That's what happens. Okay, is that clear? Yes, yes. Are you learning? We're taking a lot of time on OBRA, though it's just okay, counseling, right? No, but it highlighted a lot of things. It covered a lot of things, including the DR, because this has something to do with a pharmacist counseling or pharmacist knowledge or pharmacist being an expert when it comes to drugs. Okay. But what was the goal? To better patient care. That's always the goal. Okay. Okay. I'm not skipping. Let's go back. Drug to drug interaction, Geneva.
And anything TCA, tricyclic antidepressant,
Anything tricyclic antidepressant should not be taken with
and SSRI or MAOIs.
SSRI or MAO inhibitors. Good job. Next, Edwin. Edwin's like, why'd you cover everything? Why didn't you become specific on 2 drugs, Geneva? No, it's so hard to think. Am I reading your mind, Daddy?
Those are very known. That's why I'm like, I know those.
It is
three.
true though. This
Those
comes
three.
up on the PTCE, so take notes. Come on. Drug to drug interaction. I mentioned some. And I started teaching you guys. What about warfarin, Coumadin?
Anticoagulant.
Huh?
Anticoagulant.
Oh, what about that?
It's a blood thinner.
Blood thinner. Do they have interactions with anything?
With food, yeah.
Yeah, food. We mentioned that already.
I don't-
Drug to drug. If you have any Clyde, I'll get back to you, Edwin. Drug to drug interaction. What about you, Ashley? Drug to drug interaction. And can take NSAIDs because good. Yeah, that can be one. It's blood thinner, and then you take NSAIDs, all the more bleeding. So a case can be that. Okay? The patient is on aspirin. Okay, and the patient took ibuprofen because of sore muscles from gardening, stuff like that. And take another ibuprofen. What do you think happens? Bleeding problems is caused by taking an additional ibuprofen while the patient is on maintenance for aspirin or whatever. The drug. Okay. Kaylin, drug to drug interaction. Think about the drugs that you present on pharmacology and you say, do not take with. Antihistamines should not be taken with what? With sedatives. Why? Why do you think? Antihistamines and sedatives. Because sedatives help you, what? Calm and fall asleep. Antihistamines, a lot of them, what do? They give you a drowsy feeling, so it will increase your, what? Drowsy, especially if you're working or you're doing stuff. That's why we have warnings, especially when you're given prescriptions of what? Drugs that may cause you dizziness or drowsiness. What's the warning? What's the auxiliary label? Do not operate heavy machinery when on this medication. Okay, you know your auxiliary labels. Good job. What else? Drug to drug, Leslie? Your homework is going to be long. I'm going to add this to the homework. Drug to drug interaction. Are you writing this down? Because tomorrow I'm going to ask for this. Drug to drug interaction. Miss Jay's going to be upset. I'm going to tell her you couldn't give me drug to drug interactions. Miss Jay taught pharmacology. I'm just adding this information so you don't miss it on the PTCE. The grapefruit, what about the grapefruit? Oh, is that? Alcohol and grapefruit, yeah. Okay, that's food though. Food and drug or food and substance, okay. Drug to drug. Edwin, can you give me one? Or you're still pissed at Geneva?
I'm sorry.
It can be specific drugs. Or a group of drugs like what you're doing. Okay. Add that to your homework for tomorrow. Okay, drug to drug interaction, because I don't want to say that. I want you to go back to your pharmacology notes. You see what happens when you're just memorizing, you're like parrots. Forget. Okay, this drug to drug interactions come up on the PTCE a lot of times. Next one. Incorrect dosage or duration of treatment. What does this mean? A prescription is written with the wrong dosage. Okay, wrong dosage and wrong duration of treatment. Pharmacists should look out for this. Okay, remember we're talking about animals. Might be the wrong dosage for that particular weight. Okay, or for a particular age group. Yeah, or for a particular group of patients. Say, for example, kidney problems, liver problems, right? Because we need to adjust the dosing for kids, for people with kidney problems, if the drug is excreted by the kidneys, okay? Or for people with liver problems, if you really have to give this drug to people with liver problems, we have to adjust the dosing. We adjust the dosing for special groups of people like geriatrics, not only those with diseases, geriatrics, pediatrics, we adjust those. Okay, so the pharmacist has to check for the correct dosing and duration of treatment. What does that include? Some drugs need to be taken only for 3 days, some 5, some 30 days, right? But if that's wrong, okay? But if that duration of treatment that was prescribed was wrong. Okay? Duration of treatment, another one. When you're on antidepressants. What did I say yesterday about antidepressants? It doesn't take effect, most antidepressants.
14 days.
You need to be taking it for 14 days for you to see the effects, because it has to build up in the system. Do not stop it if you're an antidepressant within 14 days. Allow it to be in your system, okay? And do you stop right away when you're all better? Say, for example, antihypertensives, antidepressants. Do you stop right away when you're all better? No. What do you do? What did I say? What's the word?
You taper it down.
Very good. You taper down. Okay? You taper down. What drugs are tapered down? Antidepressants, thyroid medications. What else? Opiates. Very good. What else? Opioids. What else? What do you taper down? Antidepressants. I mentioned that already. Antihypertensives. Okay. Next one. Drug to allergy interactions. This always comes up on the PTCE. Okay. Scenario. Case. The patient is allergic to amoxicillin. Okay. I wrote a workbook for medication therapy management for pharmacy technicians. It's being used now for a certification program for MTL. I had to write, I think, over 100 cases. Okay. And one of the cases, because it always comes up on the PTCE, I put it as one of the cases in that workbook. And what's the case? Usually goes like this. Patient is allergic to amoxicillin. Okay, listen to this. Patient, which amongst these drugs should not be given to the patient? Because you saw on the profile, there was an information. That's why I said interview the patient, not only the name, the address, the date of birth, the insurance card, ask for their allergies, right? One of the things I ask you to do. Okay, on the profile, on the database, it says the patient is allergic to amoxicillin. Which amongst this drug will cause an allergic reaction? Okay. Ibuprofen. Okay. Augmentin, because they can throw in brand or generic in there. Aspirin. I don't know. Which amongst these drugs would cause an allergic reaction? Or which should you alert, they like using these words, which should you alert the pharmacist on?
Augmentin.
Augmentin, very good. The answer is augmentin. And always the answer is augmentin. I've seen the question. Okay. Why augmentin? Augmentin is
Brand name.
A brand name for not just amoxicillin, it's a combination.
Amoxicillin and clavulanate.
Very good. Neva earned her senior badge again. Amoxicillin and clavulanate potassium. You see how you have to know brand and generic, especially the popular ones, because they throw in a brand and a generic in there on options. Before, it's mostly generics, so you can guess, like you can do an educated guess, because generics have most commonly used prefixes, roots, and suffixes. Right? A book on Amazon top 200 drugs. How is it grouped? By therapeutic class, by codes. That's why I titled it Made Ridiculously Easy to. I use the word memorize even if I don't want you to memorize. Next one. Clinical abuse or misuse. Now you've been studying PDMP for days, talking about PDMP for days. Okay, what's PDMP?
Prescription drug monitoring program.
Prescription drug monitoring program. Who runs this? Is it federal or state? State. It's a state by state program. Okay, what does this do? To prevent diversion and identify drug abuse by our patients. Abuse and misuse. Okay. Is that clear? Okay, let's finish this up. Patient counseling standards. A pharmacist should, okay, an offer to have a pharmacist counsel the patient must be made. Items to address. Name of the drug, brand, generic, description of the drug. This all you will see on the label, right? The brand and the generic, or the brand or the generic, and then there's a description. A white scored tablet with numbers, usually the number on the tablet, right? So if it falls on the ground, you can identify what drug that is, okay? Which book do you use to identify a drug? If you pick up a drug, most drugs are white, most tablets are white. If you pick up a drug on the floor and you want to identify what that drug is, it has an engraved set of numbers, right? What book or reference should you use to figure that out? No.
Oh, got the website.
There is a website, correct? In the old days, it was a book. Ms. Shay, you covered this, right? To identify the drugs. That starts with the letter I. Identify the drug. It's identadrug. Identadrug. Yeah, that's what you use to identify a drug. Identadrug. I don't know the exact website, but it used to be a book. Identadrug.
I think that's the website too.
Identadrug.com. Is it a .com? But that's the website as well. I just don't know if it's a .com. We'll check later. Okay, next one. Name, address, intended use, and expected action. Some doctors write what the drug is for GERD, for pain, right? If the prescriber didn't write those words, are you supposed to write them? No, you have to transcribe as it was written. If the doctor didn't write for pain or for depression, you should not put that. Why? There are drugs. This drug always comes up on the PTCB as well. They have two uses. Okay. Like Benadryl, an example, right? It is an antihistamine, but people use it to help them sleep, right? One drug that always comes up on your board exam, Wellbutrin. Okay. Wellbutrin is a what? An antidepressant. But it is also used, and prescribers, doctors prescribe it for smoking cessation. To stop smoking. So now, going back to adding the use, the doctor prescribed, say for example, Wellbutrin, because the patient has seen the doctor and ask for a prescription to help him stop smoking. And the prescription did say for smoking cessation. And then you, smarty pants, added for depression. The patient will think, I go to the doctor for depression. I went there and asked him for help so that I could stop smoking. Right? So you don't want to add anything, especially the use. Right? What can you add on a SIG? Since you're transcribing SIG and inputting SIG in the system, what can you add on a SIG? I mentioned this.
The route, dosage.
The route or the route by mouth, because usually the doctors don't write that anymore, but make sure you're not putting suppositories and adding, you're not filling the suppositories and adding the words by mouth, right? By mouth is only for oral drugs, okay? So you can add the words by mouth if the drug is taken by mouth. What else can you add? The route, which is example by mouth, vaginally, rectally, those are all routes. You can add them, okay? And that's okay to add, to clarify. Okay, what else can you add? On that? What do you call that? Verb. Action words. Take, insert, instill, apply. Those are words that, action words or verbs that you can add in a prescription. But do not add the use if the doctor did write that. But if the doctor put for pain, you transfer that on the system as is. Okay? Is that clear? For erectile dysfunction, that's why you don't call out your patient. Right on the microphone and then say they're saying, hey. Okay, next one. Route, dosage form, dosage and administration schedule. That's part of what pharmacists should be counseling on. Okay. It is important that the patients know how to take the drug, when to take it, and how long are they supposed to take it. Okay. So that's a very, 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 very important part of counseling. Okay. Common side effects that may be encountered, especially side effects are known, right? You may experience this while on this medication. So the patient isn't surprised, right? Okay. Excuse me. Common side effects, including their avoidance and the action required if they occur. If this is a known thing, AKA side effects, a pharmacist should be able to counsel what to do when you experience that. Right? Okay. Techniques for self-monitoring of drug therapy. Say, for example, patient is diabetic. The pharmacist should be able to teach the patient how to monitor their glucose levels. Okay. And because of the expanding roles of pharmacy technicians, you're included in that. Educating the patient, teaching them how to use the glucometer. Okay. Next one, proper storage, especially if the drugs need to be refrigerated. You have to have ice pack, okay? You have to carry it with you with an ice pack. Okay, what am I talking about? Example. Insulin. Very good. Okay. Ashley's senior badge is back. Very, very good. Okay. Proper storage, potential drug to food interactions, which we were talking about, and we'll go back to that tomorrow. Drug to food. Okay. You have to find drug to drug and drug to food interactions, and we'll discuss that tomorrow because it comes up on the PTCE. Next one, prescription refill information. C2s, how many refills? No refills. C3s to C5, 5 refills, not counting the initial fill. Okay. Maintenance drugs, usually non-controlled. How many refills? 12. Very good. Okay. Action to be taken in the event of a missed dose. Say, for example, contraceptives, antibiotics. Pharmacists should be able to counsel what they must do because some people double up, right? Yeah. But But usually, the instructions should be take it as soon as you remember and then continue as you go. Right? Okay. Next one. Maintaining patient records. Great time. Hi there. Let's adjust your break time. Let's just finish this slide so I don't have to turn it off again. Or on again. Okay, maintaining patient records is one of the responsibilities, not only a pharmacist, but also pharmacy technician. But since we're still on OBRA 90, okay, since we're still on OBRA 90, what is it that pharmacists need to counsel on or educate the patients on pertaining patient records? Well, they don't really need to educate the patient when it comes to patient records, but they have to do these things as part of OBRA, okay? Keep accurate and up-to-date patient profiles. Information include patient's full name, address and phone number, date of birth, which will include the age, gender is important, drug profile, okay? Pharmacist comments, chronic conditions, allergies, and drug reactions. Again, question. As technicians, are you allowed to ask these information so that we can input it on the system? Yes, that's not considered counseling. Yes, you're legally allowed to do that, and your pharmacist will appreciate you for putting in all those information in the system. And your system will catch all possible errors, okay? If you put these types of information in there. I should not say all possible errors, but many possible interactions and problems. And that means the patient care becomes better. Okay, is that clear? Any questions? Let's go on break. It's 10:02 on my clock. I'll count it as 10:05. Come back at 10:35 for the continuation. Okay. Any questions? Remember your homework, put in the notes. Somebody hit the lights on their way out, please. Thank you.